NPH, normal pressure hydrocephalus, is a neurological condition characterized by the abnormal accumulation of cerebrospinal fluid, CSF, in the brain's ventricles. Despite this buildup, the pressure of the CSF remains within normal or slightly elevated levels. NPH typically affects older adults and can arise from various factors such as head injuries, brain bleeding, infections, tumors, or previous brain surgeries. Symptoms of NPH often overlap with those of other neurological disorders, making diagnosis challenging. Common signs include difficulty walking, balance problems, cognitive decline, mood changes, and urinary inconveniences. Diagnosis involves a thorough assessment, including physical examinations, neuroimaging scans like CT or MRI, and lumbar punctures to measure CSF pressure. The classic triad of symptoms in NPH is incontinence, dementia, and gait disturbances. In NPH, the gait disturbances are apractic and magnetic. Other features include urinary incontinence and dementia, which may present as inattention, bradyphrenia, and cognitive impairment involving frontal executive and subcortical functions. Magnetic resonance imaging, MRI, may show the presence of aqueduct flow void. Gait disturbances may precede the onset of dementia. It is important to note that NPH is not typically associated with a history of strokes. Neuroimaging measurements in NPH include assessing the width of the temporal horn of the lateral ventricle, which is typically widened to greater than 6 mm. The callosal angle, which is the angle between the corpus callosum and the interhemispheric fissure, is often less than 90 degrees in NPH. Another measurement is the Evans index, which is the ratio of the maximum width of the frontal horns of the lateral ventricles to the internal diameter of the skull at the same level. An Evans index greater than 0.3 is considered abnormal and suggestive of NPH. The treatment for NPH usually involves surgical intervention to alleviate CSF buildup and relieve symptoms. This typically entails the placement of a shunt, such as a ventriculoperitoneal, VP, shunt or spinoperitoneal shunt. The shunt redirects excess fluid from the brain's ventricles to another part of the body, such as the abdomen. While there are no medications specifically targeting NPH, supportive care and symptom management are important for overall treatment. It is important to note that complications related to shunt placement, such as infections or blockages, can occur and require careful monitoring and management. Raising awareness and understanding of NPH can facilitate early diagnosis and appropriate treatment, leading to improved outcomes and quality of life for affected individuals.